Hi, I'm Elizabeth Veit. I'm the healthcare reporter at the Chattanooga Times Free Press, and we're here today with Dr. Paul Hendricks. He is the Hamilton County Health Officer. And last week we asked some of our readers to submit questions that they want to know about coronavirus. We picked some of the most interesting, best ones that y'all submitted, and Dr. Hendricks is going to go through those now. So Allison Collins, our digital and engagement editor, is going to help ask the questions, and let's just get started.
All right, we have a list here of about 10 questions. A lot of you asked sort of the same version of the questions, so we'll just go over some of them. The first question we got is one that we've seen a lot, especially on commenting on our stories. It seems that the regular flu is more deadly by statistics. Is that true? If so, why are so many people worrying about the coronavirus?
Well, if you look at it by total numbers, then clearly flu is a bigger problem because we see, I think that the CDC has put out that there have been about 34 million cases of the flu in this country with, I brought notes here, about 350,000 hospitalizations and 20,000 deaths, which is clearly a big problem. And in terms of numbers, that's a bigger one. But if you look at the percentages, did a little math at home with my phone calculator, and you come up with a mortality rate more like 0.06%. So if you look at statistics, now that looks very low. Coronavirus, there's still a lot of question about exactly what the mortality rate is. Any mortality rate is tragic, and I want to emphasize that clearly. We don't want to make light of this at all. The rate we've seen quoted has been anywhere from below 1% up to 3.4%. So it's still a little unclear. In China, they were seeing mortality rates around 2%. That's clearly a magnitude higher than the flu. If you had 34 million cases of coronavirus, then we would be seeing a terrible tragedy going on. So yes, in terms of total numbers, flu is still a bigger problem. And if you've not had your flu shot this year, it's still time to get it. I definitely want to put that message out there. However, right now, fortunately, coronavirus is still at low numbers, so it doesn't look as bad, but the percentages are worse. So this is why we're trying so hard to keep those numbers down.
So less likely to die from coronavirus, but possibly it's a more deadly virus. We're still trying to figure that out. The numbers aren't all in, and it could depend on what country you're in and kind of the healthcare system there.
That's a very good point too, is when we're starting to look at statistics, it varies from country to country. China got hit really bad because they were caught off guard because it was the first place it occurred. Once they started getting on top of it, they accelerated that. But we still have places where the healthcare system is not near as robust as it is in the United States, and so the death rates are going to be much higher there. Same with the flu. The flu rate and the seriousness of the flu is lower in the United States because of our healthcare system is so advanced. In some other countries, someone who might survive in the United States may not. So that it varies by geography and by health system. We've been mainly looking at the United States. So when we start calculating mortality rates, what we get from the World Health Organization may be different from what we're seeing in the United States.
And so jumping into, this was actually a question further down, but it also is infecting more elderly, or it's more deadly for elderly people, correct? One person asked what proportion of infected elderly people will experience really severe symptoms.
Well, and this is another important factor. In the elderly, we're seeing rates of severe illness, and I'm not talking mortality here, but of severe illness, more like 8 to 10%. And so, because we know that this virus seems to affect people who are older and or have chronic health problems. In China, and people who smoke too, so there's another reason to quit smoking. In China, they were seeing older people with chronic health problems, people who smoke, were much more likely to get severe illness and to die from this. So that, again, if you start looking at statistics, it's like your average family is 2.3 people, and what happened with that 0.3 kid? Same thing in this. You start looking at statistics, you're taking a lot of people, but if you start looking at specific populations, you look at an older population or a population that has a lot of chronic health problems, they're going to be at greater risk. And this is why those people, even right now, even though the numbers are low, we know it's starting to spread around the country. So people who are older, people who have chronic health problems, really need to pay extra special attention to the kind of advice that's being given out from the CDC and local health departments.
And could you talk a little bit about children, because it seems like maybe unlike the flu, this isn't affecting them quite as much. Do we know that yet?
That seems to be true. Interestingly, again, a lot of our early statistics and data came out of China because that's where they had huge numbers. So they saw much less. I don't think there have been any deaths under 20 or 30 years old. There's been 110,000 plus people who have been affected. I may be off by, there may have been a few people, but certainly the severity in the younger population, not only children, but even up into people in their 20s and such, is much less. And we can only speculate on why that is. Maybe, improved immunity. Certainly the fact that people who are younger are healthier, that alone may be a factor. But we're certainly not seeing it in children the way we do in the older people.
Gotcha. And one question they had is, what is the virus and how did it get started? They said, I know it was in China, but exactly where and the cause, or?
Well, coronaviruses are well known. I mean,
Okay.
the broad category of coronaviruses are out there, and they're common. They cause mild illnesses, common colds. It's a common cause of the common cold in the United States and other places too. Every once in a while, and they tend to reside in animals initially, and then eventually get from animals into people. But the reservoir, as we call it, the place where it tends to reside the most, is in animals, particularly bats, for some reason.
Okay.
But every once in a while, a new virus will appear. And they tend to be, when they first show up, and particularly when they first get into people, tend to be more severe. Most people remember SARS from about 17 years ago, 2003. And SARS was severe acute respiratory syndrome. The name says it was a severe respiratory illness. It was even more serious than coronavirus, than this current one, which is because it had a higher mortality rate. There was another one called MERS, which is a Middle East respiratory syndrome, which I don't believe got to the United States quite as much. But every once in a while, a new strain will appear, which is more severe. And this is what happened with this, starting in December of 2019, which is why we call it COVID-19. They began noticing this new virus, and we don't have immunity to it, and it's obviously it has a tendency to get more in the lower respiratory tract of the lungs, so it causes pneumonias, and that's usually a more serious illness than your typical coronavirus, which causes upper respiratory.
And so what are the guidelines for how households should prepare for a pandemic, whether it's coronavirus or something else? What is the best way to prepare for it?
Yeah, the CDC, of course, which is our source for a lot of the routine, recommendations and all, has got a lot of great advice for households. And I'm going to refer to my notes here, but the usual things we recommend to everybody, obviously: wash your hands, use sanitizer if you have it, use soap and water. That works well, also works just fine. So keeping your hands clean. If you're coughing or sneezing, covering your mouth, preferably with a tissue or something you can throw away. If worse comes to worse, covering it with your elbow. But avoiding sneezing on other people, avoid sneezing into your hands, avoid coughing into your hands. Most illnesses, most viruses are spread more by hand contact than by anything else. It's also on surfaces, so keeping surfaces clean. There was a question about surfaces that I've got a little information on.
Okay.
You want me to
is it like, does it stay?
Well,
some people wondered on different surfaces, does it stay alive longer?
It was an interesting question. I wanted to do a little bit of research. It's hard to know for sure. Someone asked about if hard surfaces were worse than fabrics. It's felt, and a lot of this is theory, and a lot of it's based on the more well-known coronaviruses and such, but hard surfaces tend to be a bigger risk just because people touch them more and all. On the other hand, clearly fabrics, upholstered things are harder to clean. CDC tends to recommend to hospitals and nursing homes, that sort of thing, healthcare facilities, to avoid a lot of upholstered fabrics because they're harder to clean and things stay there longer. So the bottom line is we don't know 100% for sure, but keeping yourself clean, keeping surfaces clean is known to help prevent the spread. And if you have upholstered fabrics at home and someone is sneezing or coughing on them, do your best to clean them. But it's probably best if someone's sick at home, and this gets back to the recommendations for helping people. If someone gets sick, they need to stay away from other people. That applies to just about any virus. They should stay home. They should take care of themselves. Ideally, it's good to prepare a room in your house, which would be your sick room. And there you may want to avoid having too many upholstered furniture. But at any rate, a room that is dedicated to that person, ideally with their own bathroom, that it's easier for the person to isolate themselves. Because that's what you want to do, is you want to have separation. And, the number of 6 feet away from people seems to be based in some good science. So that person who's sick can stay away from other people and get better. You can have some masks at home so they can cover their masks. Someone has to come in and bring them food. But preparing a plan at home is obviously helpful. Being ready, making sure everyone in your family knows what the plan is, knows what to do if they get sick, staying at home, going to the doctor only if you feel like you're sick enough you normally go to the doctor. You can contact your doctor and ask for advice. Obviously, if you are going to your doctor, it's best to contact them in advance so they can be prepared for you coming. Same way, if you decide you're sick enough you need to go to the hospital or the emergency room, call in advance and say, I'm coming in, I've got a bad respiratory illness and I'm worried about this. So you might want to have a contact list to let people know. If you live alone, you might want to be able to contact people and say, hey, I'm sick, I'm going to stay at home, just want to let you know, check in regularly, that sort of thing. The precaution we talked about, washing your hands, staying home, covering your cough, cleaning and disinfecting and everything. If there is an outbreak in your community, then you're going to certainly want to avoid places where a lot of people gather. And then, at some point, you may find schools and things being closed if it gets real severe. Then you want to make preparation. Daycares, you're going to want to have preparations for taking care of the kids, for having coverage for them. You want to be prepared if your children get sick. You're much more likely that what's going to happen is the school's going to close and you're going to have healthy kids at home that you're going to have to watch. You've got to make preparations with work to know, can you work at home? Can you get time off? Can you get coverage? So there are a lot of these little details of life that's good to be prepared for in case the virus gets out there or in case someone in your home gets sick. It's important to remember that the vast majority of people who get this virus are going to have a bad cold or maybe a flu-like illness. They're going to be sick for a week, 10 days, and then get better. The vast majority of people who've caught it already, 80+% certainly, have recovered and go about their business. So it's not a death sentence. But we do know that some people do get more severely ill, so you need to be prepared for that.
And so you talked about hand washing. So how long should you wash your hands? What song should you sing while you wash your hands?
Well, 20 seconds is what they say, So, some people sing Happy Birthday, some people sing their, whatever your favorite song is. I'm not going to be a music critic here.
Our editorial cartoonist sings Stairway to Heaven. So
well, Stairway to Heaven, you'll get a good, clean pair of hands. So you can use that. But at any rate, it's important to the quick, rinse under the sink and all. No, you need to get under the sink, you need to get soap, you need to wash between your fingers. They've actually done studies and shown people tend to miss their thumbs, people tend to miss their wrists. So wash all the way up to your wrists, get the fingers, get the thumbs, and get everything good and clean. And then rinse off real good, and then dry with, most people aren't going to have a, blower at home, so they're going to use towels or something, but then keep those clean. Wash your towels, good hot water. So good hand washing goes a long way toward preventing the spread of illness and towards picking things up.
And do you recommend people not shake hands? Do the elbow bump?
We are all trying to get in the habit of doing the elbow bump or the wave. I know in the churches they're starting to push that. So yes, this is probably not a good time to be shaking hands. This is probably a good time to wave, or if you want to do a little elbow bump or something else. We're trying to encourage people to be a little more cautious in their social interactions. So.
Okay. And then what about hand sanitizer? We brought this for you to
Yeah.
show us.
You want me to, hand sanitizer is going to be the same thing as with washing.
Just one squirt.
You don't need a lot. You don't need a lot.
Get between the fingers.
Between the
Wrist.
fingers, on the thumbs, down to the wrist, between the fingers.
Rings off.
What's that?
Would you take your rings off?
Oh, well, unfortunately, my fingers are a little swollen. So,
If you can.
If you can, but the sanitizer is going to get under your rings pretty well. But if you have rings, you can easily get off. Obviously, that's a good idea. It dries pretty quickly and you're good to go. Soap and water is terribly effective too.
Okay.
So, I think the CDC says soap and water is actually a little better. Obviously, hand sanitizer is a lot more available when you're out and about. If you're not at home, it's a lot easier to get hand sanitizer. Either one's going to be effective, but if you don't have access to hand sanitizer, should we talk about the other question?
Oh yes, we got this question a lot, and we really want to clear the air of this one. So if you cannot buy hand sanitizer, does cheap vodka work also? What's your thoughts on that?
No. I had a quick question for you. If you don't have hand sanitizer, just use soap and water.
Yeah.
Most liquors are not concentrated, don't have enough alcohol in them to be effective. A lot of things online about you can mix this, you can use isopropyl alcohol, which is rubbing alcohol, you can mix it with this, that, and the other thing. Way too much trouble, way too much risk of not doing it adequately. If you don't have hand sanitizer, I know there's been a run on it, wash your hands with soap and water. That works just as well and is much better than going through a lot of silliness and wasting good vodka.
Yeah. Save that vodka for better uses.
As far as
Just kidding.
the hand washing, is there a preference over liquid versus bar soap? No. Okay. Okay.
Never heard that.
So hand washing is the best. Hand sanitizer if you can't wash your hands, and stay away from the alcohol, the vodka.
And for washing surfaces, people say, well, what should I use? There's actually pretty much any commercial sanitizer for cleaning surfaces that's EPA approved is going to be adequate. But there are lists online. You can go to the EPA website, epa.gov. You can go to the CDC website. They have links. And there are lists of sanitizers that are approved and that are adequate. So, there's a lot of excellent information on the internet. CDC.gov has a lot of excellent information. I highly encourage people to go there for details.
CDC, not just Googling and going to a blog.
Correct,
Yes.
correct. Go to an authoritative website. The Tennessee Department of Health has a lot of good information, and the Hamilton County Health Department has an excellent website, although mostly we both refer people back to CDC for details.
And we kind of already talked about surfaces, but do we know how long it lives on surfaces?
It can vary from a few hours to a few days.
Okay.
It's hard to know for sure. And that's based on studying other coronaviruses. There's still so much about this virus we don't know. It's still very new, and they're learning lots all the time, but there's still so much that's not known. It can last on surfaces possibly up for a few days, but that's in ideal circumstances of humidity and temperature and all. People have been concerned about, should I buy anything online from China and all? Can I go to a Chinese restaurant? Those are not things to be concerned about. There's no evidence of any spread through buying things online or buying things from China from items like that, particularly if it's been in transit for a few days. It's not going to survive.
Yeah, because that was one of the questions we got was, could deliveries to USA households, not even just from China, but other countries that have it, like packages, food, meals, clothing, medical items, bring the virus into homes?
Right. The risk of that is considered very low, and this is from the World Health Organization and also from the CDC. And I also found a great Harvard Medical School website that's where I got some of the information about the fabrics and all, the Harvard Medical School website. So the risk is considered to be very low. If it's something that you can wipe off a little sanitizer and make you feel better, that's not a bad idea to do if you purchase something. But generally, anything like that is going to be in transit for at least a few days, and
For so long it wouldn't
it's
matter.
unlikely. Plus, they're usually on a plane or something where it's not ideal temperatures and humidity. So we really don't see any risk with that.
Okay. And another question was, should the first line of action be to isolate myself or get a test, which you already talked about, isolate yourself, call your provider ahead of time. And when you do want to get tested, where should you go? Is it the local health department, a hospital? Where do you go for that?
So there's been a lot of talk about testing, and at this point, really, as of the last few days, the opportunities for testing are expanding. There's the commercial labs starting to offer testing. Initially, testing was restricted to people who were clearly at high risk, people who traveled from China, and then people who traveled from other high risk areas. We're starting to see it out in the community now, where there's no clear connection with the individual's travel. Maybe we've gotten it from someone else. So the opportunities for testing are increasing. Testing, we want to separate collecting a specimen versus testing. You know, you go to the doctor and they draw your blood normally for any routine test. They don't run the test in the doctor's office, they send it to a lab. And that's what happens with this. Doctor's offices, many of them are preparing and should be prepared to be able to do the testing itself, which is very routine. You know, it's a swab in the nose, a swab in the throat, trying to cough up some sputum or phlegm if you're developing that. So the actual testing itself is a routine thing. Now, because of the contagiousness, we're recommending that the people who are obtaining the test wear protection so they don't catch anything. So that's something that's being worked out in individual doctors' offices. And there are I know some systems are developing a place where they're concentrating. You know, a lot of doctors now work with larger systems, and they may have a concentrated place where they do that. So that's going to vary. So the first step, yes, isolate yourself. If you're sick, you should avoid other people, stay home. If you feel like you're sick enough that you would normally call your doctor and get some advice, and they may advise you're okay to stay home. They may advise that you can come into the office, but at least they'll be prepared. If you've got a mask at home, wear it there. If not, put one on as soon as you get to the office. And then they should be able to obtain the specimens. There's information online from the Tennessee Department of Health with numbers to call for advice for physicians and advice on how to obtain the specimens, how to send them in. Now the commercial labs are starting to offer it. Each lab will have its own procedure, so that they'd have to contact that. I would strongly urge people to not go to emergency departments unless they feel they are sick enough that they would normally go. And that's where you should, if you have a physician, if you have a practitioner that you can call for advice, start with them. Now, if they feel you're sick enough that you need to go to the emergency department, then at that point, I would go. Now, COVID-19, which is the name of the illness caused by this virus, is not an automatic have to be in the hospital disease. We make that decision clinically. If someone's got pneumonia, if they're sick, if they're out of breath, they'll probably need to go in the hospital. If someone just has a mild case, like the vast majority do, they can be treated at home. So we're encouraging people not to overreact to this, but to treat it as they would any respiratory illness, with obviously extra special attention to the fact that it is contagious and that they need to take extra precautions just to protect other people. What you're doing is really, you know, if you get the illness, your job is to protect other people from getting it from you.
Okay, and it's we get this question a lot too, but the face mask is meant for the person who is sick.
That's right. That's right. The face masks really don't do a lot for the average person out there walking around, protecting them from it if they're well. There's been some question of, you know, people who are in the high-risk areas, elderly, chronic illnesses, if they're going to be going into a crowd and they can't avoid it, should they wear one? You know, it's hard to say no to that, although there's still not a lot of evidence that it protects in that situation. But absolutely, if someone is ill and they have to get out for some reason, they should wear one. You know, say if they're going to the doctor's office, if they feel like they have to go to the hospital, they should wear a mask, because those droplets tend to get small real fast, so they don't help so much far away. But the person who's got the illness, who's coughing and sneezing, that mask will help protect other people.
Okay. Okay, so another question we received was, is the test effective when the patient has a virus but is asymptomatic?
Well, we really don't know the answer. The CDC has only been recommending testing symptomatic people. So most of the information we have, certainly in this country, has been with people who already have symptoms. As to, there's still so much about this virus that's unknown that I really can't give you an answer about the asymptomatic patients and such. We're primarily looking at people with symptoms.
And so, and the only reason you might test an asymptomatic persons if they like lived with a person showing symptoms or who tested positive?
Even then, now I think they're starting to do more of that. Early on, they weren't even testing those people. Now they're starting to test more contacts. But again, it's still unclear when the tests turn positive. There's still a lot of questions about that. So it's hard to give a good answer. It's certainly good to get negative tests back on people, but there's a certain period of time when it takes for it to come in. So we're really focusing on the people with symptoms at this point.
And can people or should people go to the health department if they think they're sick or need to get tested?
Well, to be honest, the health department is focused on some specific areas. We do not do a lot of primary care. A few of our clinics have a small number of patients, clients that they see. And if you are an established patient at a health department clinic, then you can call your practitioner and ask for advice.
Okay.
But we're not a walk-in clinic for people who are sick, and we don't do generalized testing. So we're discouraging people from just walking in and doing that, because we're going to end up having to refer them to someone else and then somewhere else, and then they're just going to be exposing more people. We have our role to play, and we are certainly working hard with hospitals and doctors' offices and meeting with them and talking with them and communicating with them regularly about best ways to manage this. So we're trying to set that system up for people.
Gotcha. So if you think you need testing, call your primary care provider, and they'll instruct you what to do, and you can go there and they will know how to collect the specimen.
And we do have a hotline we set up, and I should mention that if you do have questions and you just want to ask some things, it's 209-8383, 209-8383. It is open right now from 8 till 6, Monday through Friday. The state also has a hotline, and I don't know, I should have the number with me, but I don't have it, but it's on the tn.gov/health website. And if you go to that website, tn.gov/health, there is a big yellow banner across the front that you click it and it takes you right to all the coronavirus information. And theirs is open some later in the evening and on the weekends too. Obviously ours is local and gives local information, but those are some sources for people too. If somebody says they can't get through to the doctor, we don't have it.
Gotcha. And kind of our last question, and a good one to end on, is people want to know like how long we will be concerned about this. Will it die down in the spring and summer when it gets a little hotter like the flu does? Or kind of how long do you think we'll be talking about coronavirus?
Yeah. Unfortunately, that's another one of those questions that we don't have a definite answer for. It's so new. Traditionally, usually viruses, including coronaviruses, flu viruses, tend to quiet down in the summer. I mean, they're still around. People still occasionally get the flu in July. It's just much less likely. And then come back up in the fall and the winter. SARS hit hard for 1 year and basically disappeared after that. So maybe we'll get lucky and it'll do like that since it is similar. However, this could also fall into a seasonal pattern where it quiets down in a few months and then next fall we start seeing it again. They are working on a vaccine. It's probably, the estimates from the CDC and the experts, it's probably a good year and a half before we'll have that. But if this does become a seasonal thing, then we should be able to have a vaccine for it, next time around. So at this point, we just don't know.
Do you have any other tips you want to give people or anything else you want to mention?
I think we've covered a lot of it. I think the important thing for people to remember is this virus is out there. It certainly can be serious, particularly for people who are at high risk. There are many things we can do to protect ourselves, and there are the routine things. People ask, is there anything fancy or special? No, it's just washing your hands, staying home if you're sick, trying to avoid people who are sick, trying to stay informed. So once again, the cdc.gov, the CDC website has excellent advice. Our own local Chattanooga Hamilton County website has advice. Listen to the experts. You'll hear things on the media, and particularly in social media, that maybe sound scary, but if you hear something that you're worried about or that scares you, check an authoritative source, such as the ones I mentioned, please, before getting too upset or worried. This is something that we can manage and treat if people cooperate and do the right thing.
Awesome.
Thank you, Dr. Hendricks. I
Thank you
appreciate
so much.
it.
Well, you're quite welcome. Thanks for giving me the opportunity to talk about this.
Thanks, y'all.